Today's cardinal lesson is for the people who have been on Medicare for a while. Okay, and if that's you, you're going to want to hear this, is that Medicare and the Medicare Puzzle, as we so call it, it consists of Part A, Part B, Part C, and Part D. And so as you can see, we're all over the board. And we at Cardinal, we have over 5,000 customers nationwide, clients, people that we know pretty well, and we talk to them on the phone, we talk to them regularly. And most of our clients would have a difficult time explaining to me what Part A is and what it does for them, what Part B is, what it does for them, Part C, and then Part D and the drugs, and then putting it all together and then adding the insurance. So it is a puzzle, and it's become a puzzle over a number of years. I mean, Medicare came out in the mid-1960s. I started selling Medicare Supplement insurance in 1976 while I was in college, and I've been in it ever since. And it used to be simple. I mean, you just had original Medicare. It had Part A and Part B. We didn't even really explain the difference between the two because the premium for that was only 10 or 20 bucks a month at the time. And then we would go over that and the benefits of those two things, and then we'd offer them a Medicare supplement. It was pretty easy. We'd have it on a card. Boom, boom, boom. People would sign up and we'd get on our way. Well, it's been 15 years ago. In 2006, they added this thing called Medicare Advantage, or Part C of Medicare. So you only had A and B until then you got Part C. And then Part C is really nothing more than your original Medicare is turned into a Medicare Advantage plan, and you're now receiving your Medicare benefits instead of from the government, you're getting them from a private insurance company. And one of the reasons I'm doing this video is so many people that are on Medicare and then they've purchased insurance to go along with it, they still are a little questionable about, and they're feeling a point, they don't totally know what they have. And then if they get into a situation where their prices are going up, or maybe their benefits aren't doing what they thought they should do for them, and so now they're shopping for it again, or they're talking to perhaps us again, a lot of times they don't even know what they're looking for. So what I want to do today, and I'm going to do today, is add some clarity to all of that. So what I want to show you is you made a decision when you first got on Medicare of whether, well, first of all, you had to sign up for Medicare Part A and Medicare Part B, or maybe they just mailed you your card because you were already getting Social Security. So you do that with the government, with the Social Security Administration. Then following that, you made a decision of whether you were going to effectively outsource your Medicare to a Medicare Advantage plan, and you were going to go on Part C, or you made the decision to remain on original Medicare and then purchase a supplemental policy to go along and fill the gaps. And many folks start talking to us about both sides of this equation. They think they got a little bit Medicare Advantage plan and a little bit supplement, and they start quoting rules, and that's why it's a puzzle. And so I just want to be real clear, you can't have both things. You're either here, outsourced there, or you've got this and you have a supplement. It's one or the other, okay? So once you understand that, now what I want to do is let's talk about this side first. Because in the beginning, I wasn't too fond of these Medicare Advantage plans. When I say in the beginning, in 2006, 7, 8, 9, 10, 12, somewhere in there, they had limited areas where they were only in the metropolitan areas. They had limited networks. They had higher deductibles. They had premiums with them. There were all kinds of things going along with it that it really didn't make sense in most cases for people to go with one of these things. Is that we just left people on original Medicare and we sold them a supplement. And then most of our time and energy was spent helping them decide which company they were going to buy this from. Okay? Now, that's not the case now. This Medicare Advantage has been around about 15 years. It's grown, like in my home state of North Carolina, it's available in every county that's in the state. It used to be just in the 3 metropolitan areas, and around there, that was about it. Now you can buy from most of these companies, because it's the same companies over here as it is over here. That adds to the confusion. You can buy from most of these companies an assortment of plans living anywhere in North Carolina. Same thing throughout the country is there are still some rural areas that have very limited availability of Medicare Advantage. And for you folks, then maybe this part of the explanation is not that worthy. But most over the country, this has grown to where they've got several choices available in most parts of the country. So that's something that's changed. The other thing that's been around all along is the zero premium of Medicare Advantage. By taking your Medicare and moving it to a private insurance company, you can do that. People say, how is this? How can you offer me all these benefits and it costs me nothing? My premium is zero. And the way we do that is the government is outsourcing you by your own election. So they're going to Humana, to United Healthcare, AARP, Aetna, WellCare, Anthem, Blue Cross Blue Shield. All of these companies have put these plans together in conjunction with the government, but you're now Humana's problem for the year. Okay, is if you get sick, incur a bunch of bills, Humana's going to need to provide those benefits to you, not the government. So the government behind the scenes is paying, if it's Humana, they're paying them a big check behind the scenes, and then Humana in turn has to offer you better benefits than original Medicare, and they got to file all this with the government, and they do. So what we do in our part of the equation is we represent all those companies that I just mentioned, and we sit down with clients and we help them decide if they're going to move. I mean, in the beginning, decide which one of those they're going to go into, but then secondly, once they're in the place, they're going to pick the plan, pick the network, pick all the benefits that work well for them, and then after they've been there for a year or two, we help many people move, even within the same plan. I still like the concept, still want to stay over here, still like zero premium, just don't choose the plan I have on, I want to move to a different one. Okay, so this Medicare Advantage stuff is a very valid option, and really around that zero premium, that's the biggest benefit. And then they also include a Part D plan. So your Part D drug plan is just thrown in there, and that's zero premium as well. So that's popular with people. Many of them have dental, vision benefits, and they're fairly limited, but they're there and they're useful. You can generally get a gym membership with those. So there's a whole lot of reasons to go here and to make comparisons. Now, so what's the upside of a Medicare Advantage plan? I mean, first, it's a zero premium. The second deal, I mean, if the plan offers a zero premium, the second deal is all this extra stuff you get for no cost, okay? Now, what is the disadvantage? What is it? What would make you want to shy away from this? Well, number one is the network doctors and hospitals. So when you switch to United Healthcare or to Aetna or to Humana, you now have to go to their doctors and their hospitals that are in the network. If you don't, and you're on a PPO, you're going to have to pay more out of pocket. If you're on an HMO, you can't go to doctors outside of there unless it's an emergency. So that can be looked upon as a negative, that you have to play within a network, whereas up here on original Medicare, you can go to any doctor anywhere in the United States that accepts Medicare or hospital. So, I mean, it's just, that's the negative to these things, is the network doctors and hospitals. They also are going to tack on a drug plan, and you don't really have a lot of choice in the drug plan. You just get whatever plan comes along with your plan. So that could be looked upon. The fact that it's free is a positive. The fact that it may not exactly meet your needs to the best, it could be looked upon as a negative. Okay, so now now that we've had you down here and turned your Medicare from original Medicare into Medicare Advantage, now we're going to go in reverse, and we're going to say, no, you didn't take this option, or maybe you did take this option, but you want to get off of it, and you want to go back to original Medicare. And we're going to have to do that with the government, and we can help you do that with Social Security Administration. But you've got original Medicare, Part A and Part B. You've had it all along. It's just been outsourced. So this would be reversed. And then when you're there, you're going to have larger deductibles, larger co-payments, larger long-term liability than you had here under the Medicare Advantage plan. So you're going to need a supplement. And most people that have original Medicare purchase a supplement. So now we're going to move over here, and we're going to talk about this for a bit. Okay, so a Medicare supplement, like I said, it's been around as long as Medicare. It's just simply a policy. If you look at all the deductibles, co-payments, out-of-pocket that you had under Part A and Part B, I mean, a Medicare supplement and the best ones just fill in the gaps. Some people call this Medigap coverage. Okay, so there's about 40 to 50 different insurance companies that sell Medicare supplement insurance. They're not in all states. This stuff is regulated by the states. And we're in all 50 states in the District of Columbia, by the way, so if you're anywhere in the United States, those jurisdictions, we can help you. And so not all 50 companies are in every state, but what I have listed here are the big ones that also sell Medicare Advantage, because when you're shopping for either one of these things, if you're shopping for Medicare supplement coverage or you're shopping for Medicare Advantage plans, that's what has a lot of the people confused, is they know they got Aetna or they know they got Humana, but they just don't know if they have a Humana Advantage plan on the Part C deal or if they have a Humana Medicare supplement. These are two different things. So the Medicare supplement or the Medigap, every one of these companies sells exactly the same thing. These policies are standardized. So we have a lot of customers that have been on Medicare for a while and they bought a supplement. Maybe they figured that much out, as they all sell exactly the same thing, but they never shopped for them because they thought, well, if they're selling exactly the same thing, it must be the same price. How could they charge two different prices? And that was a mistake, because they're all different. I mean, if you look right in my home state, North Carolina, you know, for the same exact Plan G for a man who's age 70, he's single, and he buys a Plan G, which the Plan G is the best plan that's available for people that are turning 65 now. There was an F plan available for people that went on Medicare a few years ago. So some of you may have Plan Fs, and if you want to talk to us for a rate comparison about a Plan F, we can still offer that to you. Just give us a call. But for this purposes, most of the people that are buying this stuff from us, either over 65 or turning 65, what they buy is the Plan G. And the reason they buy the best is because we represent the whole list of companies. So we're going to, a lot of times we can offer a G plan for a lower price than somebody else that's selling an N plan, and they can only sell you one company. So anyhow, if we look at North Carolina, you got this person that we just described, it's $118 a month for a G plan, and in the exact same place, that's from Aetna, and from Cigna, it's $155 a month. Well, you might say, well, that's only, what, $37 a month? Well, that's $400 a year, and remember, they're selling exactly the same thing. Now, that spread is enough to get people to to move. I can add to this is all of these companies offer a household discount. So if you have another adult in your home who's 60 or over, it's going to knock 10 to 14% off of this price. And that's true throughout the sheet. So it's important to shop. It's important to look at several companies. And if you've been on one for a while, you may really want to take a look at this. Just give us a call and we can just give you a price quote of a G plan or any other plan that you want specifically for you in your zip code. If we look in California, it's the same company that's the lowest in North Carolina. In California, they're $275 a month for this same G plan. And you could move down here to Anthem at $182 a month, or Cigna's $196. So this isn't the same in every state. In Florida, it's a pretty tight spread. And Florida has regulations and the pricing of this stuff that they're not going to be that much different. But it still pays to shop. You may be on an old version of one of these companies, and you may save a lot by switching to one of the newer versions, especially with the AARP United Healthcare. You may want to switch to them if you have an older version of some company. It may work out right. We just have to look at the numbers. And I've put New York in here because New York is the most expensive state in the country for the Plan G and for the Medicare Supplement. So if, we have people in New York, we have lots of customers in New York, and many of them are going to have more of a tendency to buy the Medicare Advantage because of this zero premium business. Because they're looking at $300-400 a month for the supplement. All of a sudden that just tilts the whole thing in this direction. So what's the advantage of a Medicare supplement? I mean, why would you want to go original Medicare and then supplement and pay this premium? Well, you're going to be able to go to any doctor that you want, especially if you get seriously sick. You can go to a research hospital. As long as the doctor accepts Medicare, this stuff is going to pay extremely well. Your deductibles and co-payments are your out-of-pocket for your insurance every month or every year. The money you pay for services is going to be less over here. Under the Plan G, you've just really got $203 for this year in 2021 out of pocket for your Part B deductible. That's it. I mean, you go to the doctor or the hospital, and between the supplement and Medicare, it's going to pay extremely well. So those are your advantages for going the supplement. We have lots of people that really prefer this. We have lots of people when they get older and these premiums start going up, they're moving from here back over to here. So we're here to help you with all of that, and we're pretty much neutral of what direction you go. Now, if you're on original Medicare, you buy a supplement, then you're going to need a standalone Part D drug plan. And technically, that's Part D, and it falls under the term Medicare Advantage, but remember, when you're over here, they're giving this to you as just an add-on. If you're over here, you're going to need to buy that separately. And the prices on those in terms of what you pay out of your pocket has been coming down. We've got some of these plans that are under $10 a month now. So that's an area we can help you with. Then if you want dental and vision coverage, we sell separate policies. So you can buy a separate policy that you can add on to all of this stuff, and then you're going to have to pay for that. So that's where we're going over the disadvantages of this, is you got to pay premiums and buy stuff privately. Now, it really just boils down to, I want to educate people on how this whole thing works. So Part A and Part B are original Medicare. You're still on that when you go to Medicare Advantage, which is Part C. If you don't go to Medicare Advantage and you stay on original Medicare, then you don't have Part C. You buy a supplement to go along with that, and then Part D is a whole separate thing that you buy, and we sell these as well, okay? And so we can handle pretty much everything that's up on the board. What we're really wanting to do on this video is help you get an understanding of the whole system and have the puzzle make more sense for you that you can put it all together. We want to help you doing that. And we have some of our added services. We're CFPs. I'm a CFP. My associates are. We can help you turn your IRA into a retirement income. We can help you with minimum distributions. We can also help you with life insurance. Many times when you're going through underwriting, people want small amounts of life insurance. And then the most important thing that we do is long-term care insurance. And talking about that, all of this stuff is very weak when it comes to Medicare. You really need to buy private insurance for that. That's a separate video. I'm Hans Scheil, and I thank you for listening.